We get the people going. That's what we do on Thursday. Transformation Thursday. Transforming the way you feel about yourself today, right now, regardless of how your day started, regardless of how the week has been going. Today is a new day. Right now begins a new version of the best version of yourself. December 1st, 2022. You've made it this far. You have a reason to smile. You have a reason to be excited. You have a reason to feel good about yourself. Good afternoon. Good afternoon. I'm Duran Talley, Public Information Director here at Northeast Delta Human Services Authority, and I welcome you to our December edition of Transformation Thursday. Hope that you all have been hanging out with us all year long on these Thursdays, where we bring the best information to you about what this agency, Northeast Delta Human Services Authority, is doing in this 12 parish region that we serve. We got an awesome guest here with us today. But before we get into all of that, I want to remind you about what our mission, our vision, our tenets are. And of course, you've seen that in the intro, but you also have to know Dr. Montez A. Sizer is our executive director, and he approves this message. Dr. Sizer, how you doing? All of you out there, go ahead, comment, like, share as you're getting ready to start your lunch breaks or just some downtime. Maybe you're sitting in your car and you're just taking a moment to breathe and relax. Go ahead, comment, tell us hello, how you doing. If you're on Facebook, if you're on YouTube, or even if you tune in after the live production, feel free to still comment because it makes us feel good to know that you're tuned in with us on these Transformation Thursdays. Today is a special day because you've probably seen it. I know you've seen the billboards and you probably have seen the big purple machine navigating through this 12 parish region that we call our mobile healthcare unit. Today, we're here to talk about our mobile healthcare unit as part of our integrated care model, where we provide primary and behavioral health services. Yes, a one-stop shop to help you feel the best version of yourself, starting with your mind, your body, and of course, through great conversation and relationship and rapport with our team, we also can help you feel better in your soul and through your emotion as well. We are so proud. We are super proud to say that we have these services available to you regardless of your ability to pay. And the significant part about it is it's not just about money, but we realize that some of us don't have transportation. You need help. You need to get your cholesterol checkup, but you also need to check in on your anxiety or on your addiction. And so you get a chance to, at a one-stop shop, we'll come to your neighborhood. We'll come to your community. We'll come to your parish, park up, schedule an appointment, and allow you to get the treatment that you deserve. Without further ado, without further ado, I want to go ahead and bring in my friend, a great guy who truly cares about the work that he does, and that's Mr. Fred T. Barnette.
Hey everybody,
Hey, Mr. Fred, how you doing?
doing great, doing great.
Good, good. And cannot leave out our driver, Mr. Greg. Also, you guys see him in the back as well.
How y'all doing?
Doing great, doing great, doing great. First off, Fred, let's just talk about you a little bit. Tell us, Fred, about your background and the emphasis that you put on working in this industry for healthcare.
All right, yeah. I've actually been in healthcare as a nurse for 30 years now. The first 15, I worked in and managed a critical care, a 16-bed critical care unit. I started back to get my nurse practitioner in 2005 and finished in 2007. And once I graduated that, I still stayed at the facility that I worked at that time. And I moved into more of a primary care role. And since that time, the last 15 years that I've worked as a nurse practitioner, I've done primary care where I had my own clinics. I had patients that would come see me, and I would manage their primary care diseases such as high blood pressure, diabetes, hypertension, cholesterol issues, anything like that. We would help manage. I've worked in an emergency room in a fast track, trying to help people, that were coming to the emergency room and it may not be a true emergency, but still needed to be seen. I've done some work with that. I've worked in some walk-in clinics, which I still do a little help with that also. And then in December of 20, I came to Northeast Delta to work with integrated care. And since that time, I've just kind of grown and seeing another side of healthcare and really trying to help bridge that gap.
Yeah, no, certainly, Mr. Fred. Wow, 30 years of experience from private practice to other practices, understanding the whole totality of the industry. So important in the work that we do. I want to give Mr. Greg, our driver, an opportunity to share a little bit about your experience, Mr. Greg, and your emphasis on safety as you navigate throughout our 12 parish region.
Well, the first thing, with me is safety, for driving. When I moved to Ruston 10 years ago, after I got clean, I pursued my CDLs, and I got my CDLs, and I drove for Freeman Lumber for 10 years, and had the opportunity through Miss Conlon and a few more people asked me, would I be interested in driving this mobile unit? I say, let's go for it. And so, hey, this first thing is safety, man. They on here with me now. I was driving by myself, but they on here, so I got to really turn into a double defensive driver. Make sure that they safe and we get to where we need to go and back.
That's right. That's right. Well, Mr. Greg, we appreciate you. And for those who don't know, y'all heard Mr. Greg drop that little nugget when he got clean. Mr. Greg, too, knows all about the mental health, the addiction side of the world, and can have that peer-to-peer connection with you as well as you wait for your integrated care services. So you have a well-rounded, personally invested group that's navigating our mobile healthcare unit. And so, Mr. Greg, we appreciate you. We know you're trying to hold down the parking spot where you guys are right now. We know you're in the unit. But Mr. Fred, we'll continue in our conversation. Let's just talk a little bit more about integrated care, Mr. Fred.
All right. So what we're looking at when we talk about integrated care is really bringing mental health care and primary physical care together under one umbrella. We feel like we're trying to look at the patient as a whole. If you think about healthcare over the past several years, it's become fragmented. So people, your primary care would send you to a lot of specialists, or they would send you to a mental health provider, and then a mental health provider, if you had as most people with serious mental illness they have physical ailments also, and then they would send you to a primary care provider. And so healthcare was just a little bit disjointed. And this is a new way of thinking, trying to bring both of those together under one roof and work collaboratively and try to see that patient, that consumer as a whole and treat everything under one roof. And that decreases the chances of maybe something getting missed, one maybe doing one thing and thinking they're doing the other. And so that we're really trying to make it more of a holistic, cohesive care of the patient.
Yeah, no, certainly. And it's so important that we look at the whole, because we even, I have experience with some senior members of our community that have all these prescriptions and drugs because they're going to so many different doctors and specialists, and they're all prescribing something differently. But through our integrated care approach, we have the partnership with General Pharmacy. We have persons like yourself that are able to, hey, let's look at what we're really giving this one individual, because we're offering the services under one umbrella, one roof. And so it's a little bit more safety, and it helps also prevent misuse and abuse of prescribed medications. So the integrated care is so important. And I like Dr. Sizer's approach to it, because he doesn't just stop there, which is ultimately what led us to this mobile unit. He doesn't just look at integrated care in the true services that we render. He looks at the barriers, those negative social determinants of health as well, knowing that they are impacting our vulnerable populations. Thus, we decide to acquire this mobile healthcare unit and deploy you, Mr. Greg, and the team to bring these services to the vulnerable populations in the region we serve. So, Mr. Fred, just tell us a little bit about what can a person get at the mobile unit?
Yes. So, and like you said, Dr. Sizer had that vision, had the spirit of what we're trying to do is treat the patient or the consumer as a whole, meet all of their needs. Well, again, part of what we see with people with healthcare problems, serious mental illness in just the region that we live in. We live in the region with a lot of challenges. And so we're trying to eliminate all of the challenges or barriers to access to care. So with the mobile unit, we're actually going out into the very rural regions of our area, the most underserved. And so we're trying to bring that total healthcare experience to the person. They may have issues with transportation. They may have issues, just trying with money, trying to get somewhere. And so we feel like if we can bring that total healthcare experience to that person, then they're more likely, or we're trying to be more accessible, to that person. So that was the purpose of the mobile unit.
Yeah, certainly. And what type of services can a person get on the mobile unit?
So what's really great about this mobile unit, we can actually offer primary care and mental health services. At this time, the primary care team is the main team that's staffing the mobile unit. So we can offer, this mobile unit is basically a doctor's office or a medical provider's office. We have an exam room, as you can see behind me. We've got all the equipment to do a basic medical exam. We partnered with LabCorp and actually have a lab collection room on the mobile unit. We have the equipment. If someone wants to come in and get their lab work drawn, then we can actually draw it on the unit. We'll spin it down, prepare that specimen, and LabCorp comes and picks it up in the evenings. They take it and run it, and then those results are resulted out into the patient's electronic health record, which again, that electronic health record is available for everyone at Northeast Delta. So you don't have to search or dig for a paper chart or something like that. We're moving everything to electronic. So if someone in Ruston needs to see something about a consumer, if they're on call and they need to see a consumer's information in Monroe, they can actually get in the electronic health record and look that up. Another great thing that we also have telehealth capabilities. So this mobile unit is set up with a television, a camera, a desktop. We have a mobile Wi-Fi unit that works. And so if someone needs a mental health appointment and they can't get to their provider, if they can get to the area that we're going to be at, they can actually schedule an appointment with their mental health provider. We have a totally closed off room. We only allow one patient on the mobile unit at a time. It's completely private, and they can actually sit where I'm sitting right now and do a telehealth visit with their mental health provider. So, we can offer mental health and primary care services on the unit. And it's a really good thing.
Wow, that's awesome. So help us understand the process a little bit then, Mr. Fred. How do I get an appointment? What do I need to do? Do I just pull up where I see the purple unit, or what do I need to do?
Right. So where we're at now, we're in the early testing stages. We've seen some people. We're really wanting to work all the kinks out before, we go full bore. But if they're not a patient of Northeast Delta or a consumer of Northeast Delta, they can call our 1-800 number. And that number is 1-800-256-2522. And they'll speak with our single point of entry person, Miss Brittany. She'll do a screening to see if they qualify for our services. And then we'll schedule that person an appointment with that. At this time, we're not taking walk-ons just yet. And just some of the challenges of trying to get them into our system, try to get our electronic health records. There's some issues that we're working out now. But also, if someone is already a patient of Northeast Delta and they can't get to, just for an example, we're going to we go to Jonesboro, and if they're a patient of, say, Ruston Mental Health, and they live in Jonesboro, and it would be easier for them to see their provider by telehealth services, they can call the Ruston office. We can get that appointment scheduled, and then they can come on the mobile unit in Jonesboro and actually do the office visit, with the provider at that time.
Yeah, wow. I mean, that's special. So it sounds like it's as simple as just make a phone call, 800-256-2522. Tell somebody that knows somebody that needs somebody that need help, 800-256-2522. Regardless of your ability to travel and commute, we will come to you. Dr. Sizer says it all the time. We have to meet our people where they are. and we're taking that literal. Where you are in your community, in Jonesboro, in Tallulah, in Lake Providence, we will come to you and meet you there to bring you this life-saving care that you need. And so it's so important. It's so important in this region. Oh, is there anything since we make that phone call, Fred? When we get there, do we need anything? Do I need to bring anything, or how does it work once we get that appointment and get on site with you guys?
So once they speak with the screener and we get everything in the system, no, they'll need to bring like a driver's license, just kind of proof of who they are. We'll schedule that appointment. And we'll go from there. But everything
Awesome.
should be handled through our single point of entry person and our admin at the basically at the nearest clinic where they'll be.
Awesome.
If they're in again, I'm using Jonesboro as an example. The Ruston Mental Health Center is close to Jonesboro, so we'll tie them into that Ruston clinic.
Awesome. Awesome. Well, Fred, we certainly appreciate your time and learning about what we're doing in integrated care and with our mobile healthcare unit. For those of you who are tuned in with us and may watch this even later on, give us a call, 800-256-2522. If you or someone you know need access to services, mental health, addictive disorder, as well as primary care services, call that number. It's a 24/7, 365 number. So you don't have to wait a certain time of day. Just call and we will come to you, Mr. Fred, Mr. Greg, the other team members that are there as well. We thank you all for what you're doing, getting our services to the people that desperately need them most. Again, Dr. Sizer, the visionary, understanding that integrated care is bigger than just primary and behavioral services, but that we need to look at the barriers that's preventing individuals from getting access to these quality services. And so it takes all of these things. It takes all of us working together as a community, as a region, as a leadership to be able to move our people forward. And so, Fred, anything else you'd like to share with us?
I did. There was one thing I forgot to mention. We actually prepare our schedule quarterly. And what we'll plan to do is we'll put the next quarter schedule out, and our plan is to email that to all the clinics, the clinic managers, all the staff, so they'll have access to it. And then also, like any of our social media platforms, we really want to get that out, and then people will know where we'll be and when we'll be there. And so,
That's right.
So we're gonna, like I said, and we put that schedule out a quarter at a time. And we'll be posting the next quarter very, very soon.
Awesome. So yes, please follow us on social media. If you want to know when it's coming to your neighborhood or too close to your neighborhood, follow us on Facebook, Twitter, Instagram, LinkedIn, YouTube, and TikTok. Of course, you can always go to our website, NEDHSA.org as well, to see all of our upcoming activities and initiatives. But again, if you or someone you know needs help, give us a call 24/7, 365 by dialing 800-256-2522. Nothing else, Mr. Fred. Again, we thank you for your time. Mr. Greg, y'all be safe on that road. And we thank you for the awesome work that you're doing for the region's people. Thank you all.
I appreciate it.
Awesome. Hope you all enjoy the rest of your Thursday.
All right. Y'all have a great day.